About 1 in 20 people will be affected by colorectal cancer in their lifetime. Not all polyps will become cancers, but most cancers start off as polyps. Thus, the importance of a screening colonoscopy. Typically, the prep starts the night before, finishes the day of, and then the procedure itself is a same-day procedure. You need a ride to get to the hospital and to be taken home from the hospital, but usually most patients are fine by the next day. So essentially, typically, it's about 1 day off of work. The purpose of the prep is to clear the colon of stool debris. When the colon is clear, we can detect polyps as small as just a couple millimeters. When there's stool in the colon, we can miss small polyps, and even small polyps matter. If you have any special concerns about how you're going to do with the prep, please talk to your doctor about them. So patients ask me, why can't I just get my stool test done? Why do I have to go for a colonoscopy? Isn't the stool test just as good? And the answer is no, it's not as good. A lesion needs to be large enough, or a cancer needs to be big enough to shed DNA or to have occult blood in the stool for a stool test to be accurate. Colonoscopy can detect small polyps or even large polyps that may be missed on these stool tests. So what risks are associated with screening colonoscopy? There's a less than 1% risk of major complications such as bleeding and perforation. We do everything in our power to make colonoscopy pain-free and risk-free whenever it's performed. There's a small risk that little polyps are hiding behind folds in places where we can't see, which also goes back to the importance of a good bowel prep. If the colonoscopist thinks that there's too much risk, we stop and find a different way to screen your colon. So another question is, how do we make it pain-free? The two modalities for sedation include having an anesthesiologist present or doing what's called conscious sedation. Conscious sedation includes a combination of a sedative and a pain reliever in order to relax the patient during the procedure, prevent them from having any recollection of any discomfort that may have occurred during a procedure, and treat any discomfort that may have occurred during a procedure. In order to ensure the best colonoscopy experience for each patient, we individualize sedation preferences. We'll review your medication list, we'll review your medical history, and determine the best sedation plan. It's not uncommon for patients to say, why do I need a colonoscopy? I don't have symptoms. I don't have a family member with colon cancer. Why do I need to undergo a test like that? Well, the answer is early colorectal cancer is often asymptomatic. Current guidelines recommend that a first-degree family member with colorectal cancer is a reason to undergo screening colonoscopy earlier than age 50. The current guidelines say you start at age 40 or 10 years before the affected individual and go for screening colonoscopies every 5 years in order to determine if you're a polyp maker or not. The findings at each colonoscopy will determine when the next colonoscopy should be performed. Colorectal cancer is an extremely curable cancer when found early, and it's actually a preventable cancer. If we remove a polyp before it becomes a cancer, we've essentially cured you of cancer or prevented you from developing cancer. If you have an early colorectal cancer, it can often be cured either with surgery or non-surgical techniques. If a one-day procedure can prevent you from developing colorectal cancer, why wait? Please call your primary care doctor or go in for an office visit to discuss how you can prevent colorectal cancer from happening in your life or in the life of someone that you love. Schedule a colonoscopy as soon as possible.